I'm Dr. John Gillon. I'm a respiratory specialist, known in some parts of the world as a pulmonologist, and I work at King Edward VII's Hospital and in the London Clinic. The majority of people who come to see me have developed problems with their breathing, or they may have other symptoms such as a cough or have pains in their chest. But increasingly, respiratory specialists like me are also seeing people for investigation of abnormalities which have been found as part of tests for other conditions, like scans done for heart problems. Now, the role of the respiratory physician is to identify the nature of the underlying problem and then to formulate a treatment plan. And so I would do that by a consultation, seeing and talking to the patient, carrying out a physical examination, and then usually arranging other investigations such as further chest x-rays or scans of a variety of kinds. We may also need to do specialised testing of the functioning of the lungs, respiratory function tests. And in addition to that, sometimes we'll have to do biopsies, usually done by a simple technique called a bronchoscopy, where a fine tube is put into the lungs and specimens taken for investigation in the laboratory. Most people who come and see me are going to have conditions which fall into one of two or three main groups. First of all, diseases of the airways. That's asthma. Chronic bronchitis and emphysema, that's commonly known now as chronic obstructive pulmonary disease, COPD, and that's a rapidly increasing problem in some parts of the world, including the Middle East. Lung specialists like me also deal with lung infections, so pneumonia and tuberculosis. And of course, a very important part of our work is the investigation of suspected lung cancer. And if we then make a diagnosis of lung cancer, then the treatment of that condition is planned in conjunction with other specialists, oncologists, cancer specialists, and maybe surgeons. Also rapidly increasing is sleep apnea. That's disorders of breathing during sleep, and that's usually manifested as severe snoring, and because the sleep is so interrupted, very severe daytime sleepiness as well, which can cause difficulties with concentration and can cause depression and many other problems. And the management and investigation of problems like lung cancer and sleep apnea has been absolutely transformed in recent years. Now, I'm not myself a specialist in lung diseases of children, but London is fortunate in having internationally renowned experts in this field. And that means that the outcomes for severe children's problems, like cystic fibrosis, are amongst the very best in the world. So in summary, a lung specialist like me is going to be seeing a broad range of problems. Some of those are really quite common. Some of them are very rare. And if you are somebody who's got a rare lung condition, it's really important that it's looked after by the person who has the greatest possible experience in that particular field. So what's really great about London as a world-class medical centre is the very large number and concentration of such specialists, so that you can be sure that you're seeing the person who's the best for you. And what Invictus Health can do is to make sure that you don't see just a lung specialist, but to see the right lung specialist for your particular condition.